Welcome back to TV5 News at 9. Nearly 20,000 women will learn they have ovarian cancer this year, and almost 13,000 will die from that disease. Calling in this morning to tell us more, we have Dr. Benjamin Mize from McLaren-Flint. Dr. Mize, thanks for being here with us this morning.
Thank you for having me.
Yes, of course. So tell us, why is ovarian cancer so deadly?
Well, ovarian cancer certainly does have the bad reputation for being a particularly deadly type of cancer. And I think, the short answer is that women with ovarian cancer just don't typically get diagnosed in time. Unlike some other forms of cancer, ovarian cancer symptoms in the early stages tend to be fairly subtle. To the point where they can be downplayed and attributed to other things or ignored. And so that most women with ovarian cancer don't come in until they're in the later stages where it's more difficult to treat and the prognosis is worse.
And what are some of the warning signs that women should look out for? And are there any screenings for ovarian cancer?
Yeah, so unlike some of the other cancers like colon cancer or breast cancer, where there's effective screening tools, for women without symptoms or women without a strong family history of cancer, there's really not a good effective screening tool for ovarian cancer. And so it becomes even more important that women are aware of what some of those early signs could be. Those could be things like abdominal pain, feeling full all the time or bloated all the time, pelvic pain or pressure, unintentional weight loss or weight gain, change in bowel movements, change in appetite, any of these things that are persistent, progressive, worsening over time are things that should be addressed and brought up to the attention of your primary care provider or OBGYN. It's also probably important that people are aware of their own family history as well, because a strong family history of certain cancers could put a woman at higher risk of ovarian cancer, which could make them eligible for increased screening for ovarian cancer.
And tell us, what are some of the benefits of seeing someone who does specialize in gynecology, specifically for women who have ovarian cancer? And tell us a little bit about how you treat it.
Well, ovarian cancer is treated usually with a combination of surgery and chemotherapy. The nuances of these treatments, of these treatment decisions, the complexities of the chemotherapy decisions, the complexities of the surgeries are usually best handled by the physicians that have the highest level of training in that area, and that usually is the gynecologic oncologists. We are the specialists in this area. We have the years of training and experience specific to this disease site. And we actually have studies that have shown improved outcomes whenever a GYN oncologist is involved in the care of a woman with ovarian cancer.
And Dr. Mize, if someone has concerns or maybe they've been recently diagnosed with ovarian cancer, how can they reach out to you?
Well, if a woman has concerns or has any of these symptoms that I mentioned above, a good place to start would be to talk with your primary care provider, talk with your OBGYN to get the workup initiated. Or if you want to contact us directly, you can reach out at mclaren.org/Flint Cancer, or our phone number is 810-342-3801.
All right, Dr. Mize, anything else you want to add?
No, I think it is important, like I said, to be on top of your annual examinations. Make sure you're openly communicating and aware of any of these symptoms with your primary care providers.
All right, Dr. Mize, we thank you so much for sharing your expertise with us this morning.
Thank you for having me.
Yes, of course. And you can find more information in the hot link section of our website, WNEM.com.